One of the hardest challenges that I've come to face is the big lack of primary care, and whether it's the patients don't have insurance or there's not enough primary care providers, we will prescribe a medication for a chronic disease and then we'll say follow up, and then they're back in the ER in 2 weeks. It was kind of like we put Band-Aids on a lot of the big issues that we can't fix.
We want to get people to feel better. We want them to recover. It is distressing to a lot of us when patients come in day after day.
One of the very challenging parts is seeing those same patients over and over again and keeping the smile and keeping the compassion. Thank you.
We give them temporary solutions, but there has to be other resources out there for ongoing care in the community.
We have over 100 patients in the department at sometimes, and we have our fast track, of which is the small things that are going on, and then you have super sick patients that are waiting in the waiting room, and you're having to go out and say, I'm sorry, it's gonna be a little bit.
It's my job as an emergency care nurse to take care of you no matter what. And it's one patient every single time.
Do they give you pain meds? Pink tab, yeah. Is that you think it's wearing off?
But I can feel the pain coming from my knuckle and it's coming up to my back.
Did they numb it yet? Have they? No, they haven't done any of that?
No.
Okay, they just gave you the tetanus shot?
Yeah.
Okay. All right, let me go check.
I was at the shop. I was filling one of the tires up. It blew up and the rim flew off and it hit my hand.
Is your pain a little bit better? Okay, good. I'll be back. They're ready for you. X-ray, yeah.
They didn't put anything films for it?
And I've heard of this happening with tires. I just never seen it happen. Got the first, what do they say, front row seats. Usually I don't go to the hospital. Even if it's bad, I wouldn't even want to come for this. Yeah, insurance is too high, That's why you can't get sick or hurt, You're better off to try to patch it yourself.
All right, sir. Little poke.
If this gets all fixed up, bandaged, everything, maybe cost me $3,000, $4,000. I pay insurance, and it's going to.
That's 3 months. That's that's a month's premium. $3,000.
Exactly.
It's still cheaper to pay the medical bill than it is to pay for insurance.
It's just how, we are in the U.S. We don't have enough insurance for everybody, and if you do, that doesn't mean that you don't have a $100 copay when you come to the ER, and that's something a lot of people can't afford.
If someone doesn't have health insurance, they're not going to seek preventative care, and preventative care is really what is going to be the key to keeping our population healthy. Sometimes the change comes out of necessity. And I think more and more our leadership are really listening to the emergency nurses to find out what their needs are so that they can better serve their patients. Nurses have to find a way to have their voice heard.
This is the Nurse Practitioner Show. Here is Pat Chabarro.
I am really excited to have you join me today for a very special show. We're going to be talking about emergency nursing. We have a caller already, so I want to jump to the phone to Dana.
Hello. So many years ago, I started as a paramedic, and I noticed that the population does not truly understand the real purpose of the emergency department.
Mm-hmm.
The hospital is bombarded with things that really could have been taken care of at the doctor's office.
I think one of the mandates of any nurse, quite honestly, is education. When our patients are lucky enough to go home, it is really our responsibility to ensure that they know how to care for themselves or their family member at home, so that they know when they need to come back, so they know what medications they're supposed to be taking or when to follow up. But the other reality, too, is that patients and families do not have primary health care in the community. They don't have insurance. Sometimes it is the emergency department is the only place that they can go to receive care. Our communities are struggling. Our people are struggling. I think it comes down to soliciting the leaders in our communities and really insisting that there is adequate health insurance for all. Patients are so sick by the time they get to us that we are just chasing our tail, and they are beyond where they needed to be. If we could have caught them in the community with resources and support, then we would have been able to avoid this visit to the emergency department and probably a hospital admission. We see everybody with or without insurance, whether it is that skinned knee because the mom and dad don't know quite what to do with it, or whether it's that person in their last moments of living with cancer. We are kind of the catch-all for people who have nowhere else to go. Never question it. Know that you are always welcome, and we are always there to look after you.